Susan Lucas. I'm going to explain what Part D of Medicare is. Part D helps pay for prescription medications and is also called prescription drug plans or a PDP. Although you are not required to enroll in Part D, there is a penalty of 1% of the average monthly premium for each month you delay enrollment, or if you go without Part D coverage longer than 63 days. There are two ways to get Part D coverage. One is to enroll in a standalone prescription drug plan offered by a private insurance company, and the other is to enroll in a Part C plan that includes Part D. Either way, there are a few important things to consider when looking for Part D coverage. There are usually several different prescription drug plans available to choose from in each area. It is important to check the formulary or list of drugs that a plan covers and use an in-network pharmacy. Each plan has standard pharmacies, preferred pharmacies, and a mail order pharmacy that you can use for fulfillment of your prescription medications. It is also important to make sure your prescription medications are included in the formulary as covered drugs. Most plans have 5 tiers to group covered medications according to cost. For example, Tier 1 is for preferred generic drugs and will have the lowest cost. Tier 2 through 5 cover generic drugs, brand name drugs, non-preferred drugs, and other specialty drugs. The cost will be higher the number tier your medication falls under. There are 4 payment stages to a Part D plan. Stage 1 is the annual deductible, during which you will pay 100% for your prescription medications. If your plan doesn't have a deductible, then you skip to Stage 2, initial coverage. During the initial coverage stage, you pay the copay or coinsurance listed in your plan for that medication, and the plan pays the balance until you reach the specified total drug cost for that year. When you reach the specified total drug cost, you will enter the coverage gap, also called the donut hole. In the coverage gap, you will pay 25% of the cost for all your medications until you reach a total out-of-pocket cost for that year. After you reach the total out-of-pocket cost for the year, you will enter the catastrophic coverage stage, where you will pay minimal copays for both generic and brand name medications, or a 5% coinsurance for all drugs. If your doctor happens to prescribe a medication that has quantity limits, requires prior authorization, or is not listed in your drug plan's formulary, you may be asked to try step therapy, which is a process of trying one or more similar drugs to see if it offers the same health benefits. For drugs that are not covered on your plan, you can ask for a formulary exception. And for medications that have other restrictions, such as quantity limits, you will ask for a utilization exception. Part D plans can be very confusing and hard to navigate on your own. It is beneficial to work with a licensed agent who can analyze the different drug plans available in your area to help you find the right plan for you based on your current prescriptions. For people struggling to pay for medications, there are other programs through the Centers for Medicare and Medicaid Services you may qualify for, like Extra Help. Please contact me for your free Medicare and Part D review at 707-828-0059 or 888-985-6577. Thank you for taking a few minutes to learn more about Part D for Medicare.